why now is the time to thrive as a chiropractor. I talk to a lot of different people in chiropractic, and I hear a lot of naysayers saying, oh, it's not as good as it used to be, and oh, this is really tough, and chiropractic is really tough. First of all, if you go forward and you see all the struggles chiropractic's been through, every time we've had a struggle, we've persisted. And chiropractic became a licensed profession in every state. There was guys going to jail for practicing chiropractic, but now you're allowed to do it in every state. We go forward, and then all of a sudden we're being recognized by different insurance agencies, being reimbursed for insurance, but then that came to a halt in the late 1980s. I'm sure you've all heard of the Mercedes 80s. The end of that was the end of the chiropractic heyday, phase one, but there's phase two coming. So let me tell you what happened. The chiropractors sued the American Medical Association, and that was in 1972, and that lawsuit went all the way till 1987. I started chiropractic school in 1987, and that year we won the lawsuit in the Federal Court of Appeals. And the judge, Susan Getzendanner, found the AMA guilty of conspiracy against the chiropractic profession because we do not prescribe drugs. Why would the AMA be guilty of that because we don't prescribe drugs? The main funding source of the AMA usually comes from advertising in the journal by the pharmaceutical industry. There's very low enrollment of medical doctors in the AMA. And I didn't learn this by studying it. I had medical doctors telling me, we don't belong to the AMA, that's the drug companies. When I first heard that, after I integrated and I had 3 medical doctors working for me in the 1990s, they came to me and said, hey, we're going to go on strike. And I thought they were talking about they were going on strike against me. And they said, oh no, the Chester County Medical Association in Chester County, Pennsylvania was going to go on strike. And I asked them why. And they said, because they told us this year when we enroll in the Chester County Medical Association, which we all want to belong to, they're going to enroll us in the AMA for free. And I said, aren't you guys all in the AMA? And they said, no, that's the drug companies. That was the first I ever heard of it. As time went on, I looked up things. I wrote books, and in writing books, you do a lot of research. And I found out that the enrollment of medical doctors in the AMA was down around 8% or less. 8%. That's the minority. The vast minority belonged to the AMA. The vast majority did not belong to the AMA. So then I read an article by Dr. Kevin Campbell, who was a medical doctor, who said, you're going to see a rise in enrollment in the AMA, but don't be fooled. This is because they're giving free enrollment to students and retired doctors. So it did go up to about 12% if you count the free enrollment for students and retired doctors. I have a relative who was a student in medical school at that time, and I called him up and I asked him, hey, are they trying to enroll you in the AMA? And he said, like, how do you know that? And I found out they were giving them food, gift cards to restaurants, gift cards to Banana Republic to try to get them all to join the AMA, but the professors at the medical school he was going to said, don't join the AMA, that's the drug companies. As time's going on, what I'm trying to point out to you is there's a lot of medical people that are losing faith in the medical system. When we did integration, I was floored at how many medical doctors and osteopaths were applying to work with me as a chiropractor. I didn't think I was going to get any responses. We literally had the mail lady bringing in trays of mail of resumes of doctors looking to work for us when we advertised back in 1996, 1997. So why is that? When the AMA lost that lawsuit against chiropractic, their vengeance was to buy all of the billing codes that everybody uses. And they are the owners of the billing codes now, the American Medical Association. They own the billing codes that chiropractors use, that physical therapists use, that family practitioners use. And what they did was they started manipulating those codes so that chiropractors got paid less, physical therapists got paid less, and family practitioners got paid less. And the idea was to keep the family practitioner having to rush through the visit. So they were paid based on an E&M code. They weren't paid a whole lot, and they weren't paid based on the time they were spending with the patient. They had to rush through the visit. And when they rush through the visit, the fastest way to get out of the room for a medical doctor is to write a prescription for the patient. And they found that's what they were doing. And all these doctors who applied to work with me back in the 1990s, that's what they were complaining about. That they didn't like that wasn't real medicine. They were being forced to practice that way and they hated it. That means the discontent of the medical profession with the medical hierarchy in this country was getting bigger and bigger. You fast forward, a couple things happened. In the 1980s, a little drug popped up on the scene. It was OxyContin. That was an opioid that was prescribed for pain. And if you've seen any of the stories on Netflix or on Hulu, Dope Sick or any of the different stories about that, Empire of Pain is a great book to read. Basically what was happening is this pharmaceutical company knew they were addicting people. They knew that there was a large percentage of the population, or a certain percentage of the population, that was easily addicted to these drugs. Then they started looking for regions of the country where it would be easier to addict people to these drugs, like Appalachia, like parts of around Boston, blue-collar areas, working areas, and they targeted those people and caused an awful lot of deaths. The tolerance for opioids as a remedy since the 1980s, late 1980s, caused the following stats. In the 1990s, about 11,000 people a year annually would die of an overdose of opioids. You fast forward to today, that number is 150,000. That's a pretty big increase. The Lancet, British Medical Journal, or it's a journal in England, the Lancet, in 2022 said they estimate another 1.2 million people will die in the United States from an opioid addiction, and if you divide that by the number of years, that's 150,000 a year, up from about 10,000 a year historically. Ridiculous. Medical providers are going, why do they approve a drug like this? More discontent. There's studies and information coming out now about antidepressants where there's studies from Harvard saying that the placebos in those studies outperformed the antidepressants. More discontent. It's starting to come out now that these drugs are dangerous and cause homicidal and suicidal thoughts. More discontent. Now they're coming out with the answer to that to make it safer, using ketamine, a hallucinogen, in conjunction with antidepressants. All this stuff sounds horrible, but what it's doing is it's eroding the faith of the medical profession within the medical profession. So then you look at the bill that was passed in 2010, the Affordable Care Act, and you look at the name of it, you go, Affordable Care Act. Oh, let's make America's healthcare more affordable. Why would we have to do that? Back in 2010, the cost of healthcare in this country was $2.3 trillion with a T. That's pretty expensive. When you look at how expensive it is compared to the rest of the world, we were 51% of the world's healthcare bill, and we were 4.5% of the world's population. Less than 5% of the population spends more than half of the healthcare bill. We must be getting really good healthcare. But when you look at how we rank, our life expectancy, and this comes from the Office of Economic and Cooperative Development of the United Nations, our life expectancy is one of the lowest of all the developed nations in the world. What are we getting for our dollar? We're not really getting great healthcare. Our diabetes is out of control, our weight management is out of control, heart disease, suicide. Suicide rate is up so high that for every homicide you ever hear about on the news in the United States, the last few years, there's been 2 suicides. And that is the side effects of some of these drugs. People in the medical profession are starting to go, I don't know if I actually want to do this. And a lot of family practitioners have dropped out of healthcare. They don't want to be part of healthcare anymore. Now they had to fill that gap. Who do they fill the gap with? Nurse practitioners. There's now almost 400,000 nurse practitioners, and most of them in most states have autonomy now to run their own family practices because there's not enough medical doctors that want to do that. They are so fed up with the whole system. These are all flags to say, you know what? If somebody comes along with a better idea, these people will join them. What do? You say the Affordable Care Act was passed and they wanted to lower the cost of healthcare. Well, what happened? You fast forward in 2021, 11 years after that bill was signed, the cost of healthcare was $4.3 trillion, double what it was in 2010. Double. So why did they call it the Affordable Care Act? I don't know, but that helps you and I as chiropractors because we know we're not contributing to that bill. We're being cut. Where's all that money going? If more than twice the amount of money is being spent on healthcare since they signed the Affordable Care Act, and everybody's policy got more expensive, everybody's co-payment got bigger, and everybody's coverage got smaller, where's the money going? The money's going to the pharmaceutical industry. And we've been swayed or convinced to believe, as a country, that healthcare is getting rid of symptoms. In fact, there's a term now being used widely of overutilization, meaning you're giving too much care. You're wasting our healthcare dollars by giving too much care. What's too much care? If they don't have pain, you shouldn't be treating them. Whoever said that pain meant that you were healthy or unhealthy? See, if you were actually look at the two, which is more accurate, pain is healthy. If you break a bone and your body goes to heal it, it's the swelling of that periosteum layer that heals that bone. That's very painful. Healing is painful. Covering up pain shouldn't be the job of the doctor. Finding out why there's pain should be the job of the doctor. Find out why somebody has chronic degenerative arthritis should be the job of the doctor. Figure out how they can improve the function. That is the job of the doctor. And chiropractic historically has been a functional treatment. When we treat somebody, we're actually relieving pressure on the spine. We have vertebrae that get stuck. Now, there's a lot of discontent now, even in chiropractors. Well, that's not true. We don't do that. Maybe we do this. Maybe we do that. I will tell you this. My wife is a physical therapist. When I first got injured in 1986, I had a serious neck injury. I had a stinger. I was temporarily paralyzed. I was not in healthcare. I was a marketer. So what happened was she took me to the hospital. The doctor looked at me and said, we don't know what you did. After he's told me I broke my neck, then he said, we don't know what you did. The x-rays are negative. Here's some medication. And they were treating me with medication, and I was taking medication and I couldn't even get out of bed. I was so drugged up that I woke up sometimes and didn't know what day it was. Those drugs weren't fixing me. They were just numbing me from the pain. And I finally said, you know what? I can't keep doing this. I have to do something different. There's something popped in my neck when I had this injury, and it's not right. And I have pain down my arm and up the side of my head. So I think I'm gonna go to a chiropractor. My wife, being a PT, didn't want me to do that. She was misled about chiropractors being dangerous when she went to school. But she went with me. And now her specialty is traumatic brain injury and stroke rehabilitation. And the way she looks at a patient is she says, okay, if this patient's in a coma, which 3/4 of her patients when she got them were in a coma, her first job was to wake them up. How did she do that? She would put these patients on a tilt table and tilt them into a weight-bearing position while they're strapped in with a collar for their neck so their head doesn't go forward, and they're standing in a weight-bearing position while they're in a coma. What does that do? It loads the joints, the weight-bearing joints, which are loaded with proprioceptive nerve endings. And we all know proprioceptive nerve endings are what tell you where you're at in space. That's how you can walk through the dark and not fall over. That's how you can walk with your eyes closed and not fall over. And it's your balance. What happens is if those joints get stuck, then they're not sending information to the brain. One of the things that those joints or those nerve endings do also is they trigger a process called synaptogenesis. So that means creating a new synapse. So what my wife was doing with a head injured patient was loading them in a weight-bearing position while they were unconscious to stimulate those nerves several times a day to create new pathways around the damaged part of the brain. And when she saw what the chiropractor was doing, unsticking weight-bearing joints, it dawned on her, holy crap, these are the most important doctors there are. They're doing something functional. They're actually relieving pressure off the nervous system so these buttons can work again and program the brain. That's what we do. Whether we like it or not, that's what science says we do. Can we help a herniated disc? But that's just a good side effect of it. What we're doing is programming the nervous system. Study after study, even from journals, prestigious medical journals, show a chiropractic adjustment actually flips you into parasympathetic mode, or as we all know is the healing mode of the body, and takes you out of the sympathetic mode, which is the stress mode of the body. So all at the same time as all this is occurring, the healthcare is going into symptom. They're going so overboard, creating tons of money, billions of dollars for drugs that don't do anything functionally. And here we are doing something functional and not getting any recognition and actually getting our reimbursement cut. Well, America's getting pretty fed up. We had that happen. We had the three crises I talked about, the opioids, the antidepressants, the Affordable Care Act, and now comes COVID. And with COVID, we have the American Medical Association, we have the government telling us, get the vaccine, one shot, you'll be safe, and people got the shot. And then, you need a second vaccine, and people got the shot. Oh, maybe a third, maybe six, and people got them, and they're going, well, we were told one shot, you won't get the vaccine. We got six, and we still got COVID. Our president even got COVID after getting all the boosters. So America's going, what else are they not telling us? What other lies are they telling us? What other things are they doing? We don't have to trash the pharmaceutical industry. We just got to let people know what's happening and what we do. So when I work with medical providers, we are finding medical providers who are fed up with the system, and they're not hard to find. There's a lot of them. We educate them on ways to functionally assess and treat the patient. And by and large, when these doctors and these nurse practitioners learn this, they love it and they want to work with us. And we start doing things that help the body to functionally improve, not just get rid of the symptoms. See, symptoms are the worst way to judge your health. We all know this, and I'll give you 2 stats that prove that. If you look at heart disease, which is the leading cause of death in the United States officially, heart disease, 50% of the time when people have heart disease, the first symptom they feel is the heart attack that kills them. So if we're waiting for the symptom to tell us when to get treatment, 50% of the people who die at a leading cause of death are waiting too long. If you look at the second leading cause of death in the United States, cancer. I ask people, can you have cancer and not have tumors? Everywhere I go, everybody says yes. And I say, for how long? And they say, for years, which is true. So symptoms are the worst way to judge your health. They're the worst way to judge when somebody gets better, and it's the worst way to decide whether somebody is overutilizing care or not. If you're improving function, and you can document function, which is what we teach, you can prove what you're doing is helping that patient. But we're not relying on insurance anymore. America is realizing the insurance was covering those vaccines, the government was paying for those vaccines, and they didn't work. In fact, now we have 15-year-olds dying of heart attacks, and it's not occasional. I've heard of more teenage boys dying of a heart attack on an athletic field in the last 4 years than I did the entire 58 other years I've been alive. America's starting to question everything, and they're going, if you can show me how you can help me without hurting me, I'll even pay for it. You have to know how to ask them for that money, which is why we have a sales course. We teach you how to have a team that asks for the payments to get the services that you deliver that will save these patients' lives. Let's just look at this a different way. Let's look at the market. Chronic degenerative arthritis, pain from chronic degenerative arthritis is the most lucrative part of healthcare. If you look at what pain generates, this is without physical therapy, without chiropractic, just the pain market, which is mostly medication, it's $800 billion a year. The Institute of Health Metrics and Evaluation at the University of Washington Medical School says 60% of that is for spinal pain. That's in our wheelhouse. We treat spinal pain. Are we going to treat the pain, or are we going to treat the function? If we treat the function, we should get paid for it. But that 60% is $460 billion a year. And the only profession I know that's actually making traction in functionally treating it is chiropractic, probably physical therapy right alongside it. So you look at that, chiropractic only generates $15 billion, and you go, that's a lot of money. Yeah, for one person, but you divide that across an entire profession, treating the most common ailment that human beings suffer with. We're not even paying for the cherry on the cake. The drugs are taking all that. They're taking the cake, the plate, the knives, everything. The money they're generating is beyond belief. And those drugs do not do anything to fix the patient. So now is the best time for chiropractic. If we can just let people know what, we don't have to trash anybody else. We just tell them what we do and how what we do works. You're gonna have people coming to you, and they're gonna want services. There has been an assault on chiropractic to trash our name. It was to say that we were dangerous, and we proved that wasn't true. When I graduated school in 1991, cover of Time magazine, chiropractic linked to strokes. And I thought, man, I picked a bad time to graduate chiropractic school. But when I read the study and I started looking at the numbers, I realized the average chiropractor would have to be in practice for 600 years to have it happen once. Then you could say, yeah, there's a link, a very tiny link. In fact, in the study, they said it's more likely that you would have a stroke from getting your hair washed. It was more likely that a plumber working underneath your sink would have a stroke because of the position he was in compared to chiropractic. So we proved what we did was safe. We even got the president of the American Heart Association to say it's more dangerous to take a baby aspirin than it is to get a chiropractic adjustment. So that kind of backfired on our opponents. But what didn't is when they say, oh, they overutilize care. They rip you off. They treat you when you don't have pain. And what we need to do is educate the American public about what is function versus pain, and that everybody has a different pain tolerance, and it's a bad way to judge the health. If we can do that and get medical providers to work with us to educate the public, that would give us validity. And there are many that are willing to do it. I know that during COVID, I think President Biden said that 38% of all the healthcare practitioners got fired from the hospital because they refused to get a vaccine. That's the people you're looking for. Those people are willing to say, I'm willing to lose my job than do something I don't agree with. That is people with integrity. You find somebody like that and you give them systems, which we help teach, on how to treat things functionally and get results functionally so pain goes away and stays away and you don't have to keep taking these pills. You're gonna have a friend for life. And if we do that, we will get over the tipping point. If you're familiar with Malcolm Gladwell, he talks about the 15% tipping point. We're at 10%. Chiropractic has been at 10% for 130 years. And nobody wants us to get beyond that because they know if you hit 15% of the population, game over, we win, everybody wants it. We just need 5% more. If you're willing to work with medical providers who think very similar to what you do, you can get a lot of people to come in for care and get results, and that will push us over the 10%. Now is the best time for chiropractors to thrive. If you want to learn more about this, is what we talk about all the time, and we have systems in our businesses to help you thrive. and to help you get paid for what you do. We're not ripping anybody off. We're actually delivering services that Americans need to end the insanity of chronic back and neck problems and knee problems and hip problems and foot and so on. If you want to know more about that, somewhere on this page is a link. You can click on it. It's either below me or above me or it's drifting up the side, but find that link, click on it, and it'll connect you with somebody to talk about our blueprint. It's talking about a blueprint that helps you to learn about these systems where you can actually get more people under care and get chiropractic to get the recognition it deserves. And that's how we're going to thrive in this market.